It's highly cost ineffective for what you're paying for, but you're paying for it. Don't be seduced into the fact that there aren't those horizontal arrangements. And so I think we're able to show quite strongly in some of our work the offsets for some of those capital investments. Similarly, we're looking for things to, not just things to come as one output, but outputs to become coordinated, because it's often the weakest link that in fact where things go wrong. It's not the one particular program, but something that it relies on. The connections that David talks about starts to go wrong, and that impacts on that program. So a good program, and we've seen this time and time again, we wonder, why does a program going so well suddenly stop working? And if you examine it, you'll see it's because some of the vital connections, the heartbeats that it needs in other areas have changed. And so it's not that the program itself has, but its context has changed also. Much stronger links between policy and operations. Policy used to be at a very high order level, as you recall, and so in years gone by, policy was very much about documents and writing written frameworks. Nowadays, policy is much more about live frameworks. It's about thinking, and it's the way we think, and it's about the way in which we put things together. It's got a much stronger link to operations, and so we have to think about that in terms of about policy. The challenges for evaluation. We have to focus really where the gains are great. It's this tendency to want to evaluate. A lot of people come, I used to do quite a bit of evaluation work, and people would come and say, I need an evaluation. I'd say, well, why do you need an evaluation? And people would see that they need evaluations for various reasons, many of them which really couldn't be justified. You've got to think about the gain and the greatest gain from the work that you're doing. What you're really looking for is this. You're looking for an approach, an evaluation approach that gives the level of certainty at the least cost. And one of the things that I was saying to somebody here before is one of the things we discount so much is the program managers and the people who are running the program and their knowledge and expertise. This is where the bringing in of the outside evaluator and discounting all that knowledge. I've seen many a program manager, I've gone to do an evaluation, and they've explained the successes, the failures, that have had all the insights in the world, and I say to them, why do you want an evaluation? You know what's happening with this program, you understand the dynamics of the program. And they'll say, because I'm too close to it. I'm saying, well, that's not necessarily a problem. Trust in your own judgment, trust in your own ability to reflect on your program and your scope of evaluation. It is not invalid to be able to do that. In fact, it's very important to be able to do that and have those sorts of insights. One of the things for us is the evaluation activities across portfolios. I mean, this gets very difficult when you're trying to track something that has got implications across a range of portfolios, because at one level our portfolios are a really useful way of organising our government. Obviously, we have to have some breakdown, but the difficulty of portfolios is it really drives the silo mentality. Silos don't come in at the middle. To be fair, they're driven from the top. As soon as you give a minister that responsibility becomes all focusing. So the sense that we have to starting to work across portfolios. And one of the most important things I think that's happened that supported social inclusion has been this Premier's view of having horizontal as well as portfolio accountabilities, which I think has really changed the way in which we do that. Francine talks a lot about the joining up roles across government. That's very important too. And also, one of our biggest problems, we are so information rich, and we have so much data rich, and we're so information poor, it's just not funny. You cannot believe how difficult it is nowadays to get reliable data out of the systems. I don't know if you experience this, I'm sure you do. We, for example, in the mental health reference, we've been working now for a while, we cannot yet get one clear insight into how many clients there are of the state mental health system. We can't get the system to actually explain the difference between an episode of service and a client. And of course, as you can imagine, you understand, you think differently about a system if you know that. 10,000 clients going through once is different to 100 clients going through 10 times. You design different systems. So if you don't understand that dynamic, and we still cannot get that simple information. And looking around the world, it's a similar problem. And I think whilst we have all of this gathering and data and information, we have very little insight really into where we're going, and it's something that we really have to get back on.
My view, sorry, just on that point, and that's a comment I've heard for many, many years now. Can I ask you, what do you think is the underlying factor that?
Well, I think there are three things. The information, the system that they have, the actual hardware side of it is primitive, to put it mildly, primitive. Like, there's not enough. People still don't even have access to computers in many areas. And then they say, well, they're not inputting the data. I said, well, they're not inputting because they don't have access to a machine. I mean, that's pretty simple reason why that's a problem. And similarly, there's still in mental health a big tussle between the paper-based recording systems and electronic records. And so what gets onto electronic records, and so the data varies from officer to officer, from professional to professional. You know, so some do, some don't. And that means you've not got that compliance with the data, and that people will argue is because they don't see any use in the data. Right? They don't use it. So if you don't use it, people don't value putting it in. So it's in one of those awful cycles of what the things called rubbish in, rubbish out. You know, people don't value it, so they don't put it in, and then all you try to work through administrative data. So it just needs a real overhaul. It needs a third millennium view of IT. But my thesis very strongly is that evaluation is not a specialist, but it's a headset and a skill set, and anybody can have and should have this headset and skill set. I'm sure they say before they teach you this in your course. Needs to be incorporated into everyone's work. It's not something that should just come in as a specialist activity. We should be thinking this way. It really is what I call a culture of respectful inquiry. That's all evaluation is. You just have to have that headset that says, I need to understand this in some way. I need to understand what's going on. You develop theories, you ask questions, and you listen. And the active listening stuff that I'm sure they still teach you, I mean, it's still a really important part of evaluation and how we do it.